So, good afternoon to all. This is the part two of disorders of infancy, childhood, and adolescence. In the first part, we had learned about the disorders of psychological development. And in today's lecture, we will going to learn about behavioral and emotional disorder with onset usually occurring in childhood and adolescence. So, in this part, we have some sorts of disorder. For example, hyperkinetic disorder, conduct disorder, emotional disorder with onset specific to childhood, like separation anxiety, phobic anxiety, social anxiety, and siblings rivalry. Disorder of social functioning with onset specific to childhood and adolescence, like elective mutism, reactive attachment disorder, disinhibited attachment disorder, tic disorder, and other behavioral and emotional disorder like non-organic neurosis, non-organic encompass, stuttering, and cluttering. We will go through one by one, first starting with hyperkinetic disorder. It is also known as attention deficit hyperactivity disorder, in short ADHD. So there are three types of ADHD. First is predominantly inattentive type, predominantly hyperactive type, and third one is combined type. So inattention, hyperactivity, and impulse has some sort of behavioral projection presentation, which are as follows. In inattention, the child fails to pay close attention to details or make careless mistakes in schoolwork. The examples are missing details such as dates, instruction while writing, not reading the question correctly and answering the question before completely reading the question, spelling or grammatical errors, missing words and spelling errors in writings. These are because of inattention. These are not because of specific uh, disorder of language or writings. They have trouble staying focused on task or play, seem not to listen even when spoken to directly. They will see here and there while you are directly interacting with them. They have a hard time following through on instructions and not finish schoolworks and chores. So there is a problem in following through on instructions what have been given to the child by either parents or teachers. Have trouble organizing tasks and activities. Their tasks will be disorganized. They stay away from or not like tasks that need focused mental effort, such as homework, usually the study material. Lose items needed for tasks or activities. For example, if some sort of toys are needed to play a game, they will miss. And school assignments, pencils, erasers, uh, they will lose items which are needed for certain type of activity. They are easily distracted by other things, thoughts or activities rather than finishing a task. For example, a child is doing his or her homework and some sort of distraction or sound is there, which is not ample enough to distract normally. They will get distracted by those subtle stimulus. They forget to do some daily activities, such as forgetting to do chores, household chores, or school activities. The second set of symptoms are hyperactivity, and impulsivity. So this will be seen in the behavior of the child, like they will fidget or tap hands or feet on the furniture or squirm in the seat. Squirm means seat पे बैठे बैठे हिलते रहना. Have a hard time staying seated in the classroom or in other situations. This may be complaint of class teacher also. The child do not sit quietly on in the classroom. Be on the go in constant motion. Be on the go means they will constantly in keeping themselves moving in the environment. They run around and climb in the situation where it is not proper. For example, in classroom or in the relative's house, which they have been visiting. Have trouble playing or doing an activity quietly. They will make lots of noise and cannot play or do activity silently. They will talk too much, blurts out answer. Blurts out answer means before listening to the whole scenario, they will give the answer while the question is not complete. Interrupting the questioner. Have trouble waiting for a turn. They will not wait for their turn. For example, they will not wait what is being brought by the uh, father, and they will not. They cannot keep their turn among their siblings. And similarly, in school, they may break the line. They interrupt others' conversation, games, or activities. When two adult person are talking, they will interrupt between them, or some game activities going on. They will interrupt into that game. So, what is the difference between typical development and child having ADHD? So, it is common. It is common for healthy children to exhibit behavior such as inattention, which is a common trait or behavior, and hyperactivity and impulsivity is also a normal finding because young children are inherently energetic and may continue to display high energy levels long after their parents have become fatigued. Children who experience academic challenges but maintain positive relationship at home or with peers may be facing issues unrelated to ADHD. So what requires to diagnose a ADHD is that symptoms should be severe out of context of mental age, out of context of a single situation. This will happen almost in all of the situations like home, whether it is relative's house or school. Now moving on to conduct disorder. Conduct disorders have two parts, conduct disorder and oppositional defiant disorder. In conduct disorder, what happens is this disorder manifests before the age of 10 and frequently between the age of 10 and 19 years. It is prevalent in male. There are four primary behaviors associated with conduct disorder. The first is aggression towards individual and animals, as well as the infringement of others' fundamental rights, property destruction, deception, including lying and theft, significant breaches of established rules. So indicator of aggressive behaviors may be bullying other children, showing physical aggression towards other and potentially involving weapons. There will be verbal altercations between among the children group, threatening behavior to the others, coercion into sexual activities, and shifting blame onto others' personal actions, inflicting harm on animals. Indicators of property destructions encompasses deliberate starting fires at places they are fond of setting fires, vandalizing or damaging the property of others. Indicators of deception, lying, and theft may include lying to gain favor or evade responsibilities, stealing from individuals or retail establishments, breaking into residence or other business premises. Indicators of rule violations consist of disregarding rules without justification, skipping schools means truancy, running away from home and stay in night at other places, frequently contravening parental rules. Additional sign which may present in conduct disorder may be excessive consumption of alcohol or drugs, engaging in frequent and hazardous sexual activities, exhibiting a low tolerance of frustration, displaying aggressive behavior without attempt to conceal them. They do not regret or feel guilt about their aggressive behavior, lacking remorse of their action, lacking guilt feeling, experiencing difficulties in forming and sustaining relationships in friendships. These symptoms of conduct disorder in an adult may be diagnosed as antisocial personality disorder, which you may have learned in personality disorders. So you may have found that these behavior are found normally in the child and adolescence group, but there is a set of criteria for diagnosing conduct disorder. Means presence of any one of the symptom is not leading to diagnosis of conduct disorder or any of the psychiatric disorder. So set of symptoms and constellation of symptoms must be present there to be diagnosed. Now, oppositional defiant disorder known as ODD, it has main three areas. The first one is anger and irritability. They are argumentative and having defined behavior. They have vindictive nature of their behavior. What is vindictiveness? Vindictiveness is to take revenge. Additionally, many children diagnosed with ODD exhibit moodiness, mood swings, a tendency to become easily frustrated, and having low self-esteem. There is also a possibility of substance misuse, including drug and or alcohol. What is there in anger and irritability is having a low tolerance for frustration and lose their temper quickly. Experience frequent episodes of anger and resentment. Be overly sensitive and easily irritated by others. Display consistent anger and disrespectful behavior towards others. The basic theme is defiance. In argumentative behavior, they engage in excessive arguments with authority figures like class teachers and elders, actively resist following rules and requests, shift blame onto others for their own errors, having blaming tendencies, intentionally provoke or upset those around them. So they intentionally poke others to upset them. They exhibit spiteful behavior and desire for revenge, making hurtful and malicious comments when feeling angry or upset. Now moving on to anxiety disorders of childhood period. First one is separation anxiety disorder of childhood. So young children frequently exhibit signs of anxiety or distress when parting from their parents or primary caregivers. This is a normal behavior. But this phase begins to diminish around the age of 2 to 3 years, and object permanence start establishing at this age. There are intense and recurrent anxiety when contemplating separation, when distance from home or loved one is observed. Intense fear of losing a parent due to illness, death, disaster, or potential harm. There will be an ongoing apprehension about adverse events such as the possibility of being lost or kidnapped, which could lead to separation. A reluctance or outright refusal to be away from home due to the fear of separation. May also express discomfort with being alone, particularly if they have reached an age where being alone is generally expected. Refusal to sleep away from home or to fall asleep without presence of a parent. They have recurring nightmares related to separation and frequent complaints about physical symptoms to gain attention, not to be separated from their parents or primary caregivers. Now, phobic anxiety disorder of childhood. So, children like adults can develop fear that is focused on a wide range of objects and situations. Some of these fears or phobias, for example, agoraphobia, are not normal part of development, so it should be coded. in the separate category for, that is for uh, agoraphobia with or without panic attacks. In these children, some fear shows a marked developmental phase specificity and arise in a majority of children. This would be true, for example, for fear of animals in the preschool period is a normal behavior. To diagnose phobic anxiety disorder, the diagnostic guidelines are, the criteria A is the onset is during the developmentally appropriate age period. For example, some sort of fear is expected at 2 to 3 years age and which persists at the age of 6 and 7 years, then it should be considered in the diagnosis. The degree of anxiety is clinically abnormal. The anxiety does not form part of more generalized disorder and should be diagnosed as generalized anxiety disorder or GAD. Social anxiety disorder of childhood. So children diagnosed with this disorder exhibiting continuous and recurring fear and or avoidance of unfamiliar individuals. So they have social anxiety for strange persons. This fear may predominantly manifest in interactions with adult peers or both. It is linked to a typical level of selective attachment to parents or other familiar figures. So they are attached to parents or other closed one, but not to the distant person or strangers. So significant challenges in social functioning are expected in social anxiety disorder of childhood. This social anxiety have different behavior at different developmental ages. For example, in preschool children, they may have fear of new things. They may show irritability, crying or whining, freezing or clinging to the parents, refusing to speak. In school age children, the symptom may be reading, there may be fear of reading aloud or answering questions in class, talking to other kids, being in front of the class is avoided, speaking to adults are feared of. They may have fear of musical or athletic performance activities. They may have fear of ordering food in a restaurant, fear of attending birthday parties, fear of having friends visit. They may worry about being judged by others for their behavior. They may have refusal to participate in activities or school. What happens next in teenage? In teenage, they may be quiet, keeps to him or herself. They may become more withdrawn if encouraged to talk. They are hesitant and is passive, is overly concerned about negative evolutions, fear being embarrassed or humiliated. They may found to be having crossed their arms, keep their head down, displays few facial expressions, have nervous habits such as hair curling or fidgeting. They may have poor scholastic performance also. They may potentially does poorly in school activities, studies, doesn't raise his or her hands in class, avoids classmate outside the class, fears performing in front of others like public speaking, fear speaking up in class, is uncomfortable in the spotlight. Do you know about the spotlight? The light which is projected on someone on a stage. They may sit alone in the library or cafeteria. They may afraid to ask the teacher for help. They may be afraid to walk into class late. They may refuse to go to school or they may totally drop out from the school. Behavior with peers means colleagues, friends, or classmates. They may become uncomfortable in group settings. They may have few friends. They may afraid to start or participate in conversations. They may afraid to ask others to get together. They may afraid to call others. They avoid eye contact. They speak softly and mumbles, appears to always be on the fringes, reveal little about himself or herself when talking to others. So they have such an intense kind of anxiety for social situations. Now coming to the siblings rivalry disorder, this refers to a persistent discord that occurs among children who are brought up within the same household. Manifestation of sibling rivalry may include verbal and physical altercation with each other, insults and name calling of each others, reporting each other's misdeeds and petty disputes, ongoing competition for parental attention, expressions of jealousy. You can say this is a kind of discord among the siblings. There are postulated causes of sibling rivalries like significant life transitions, for example, relocating to a new residence, anticipating the arrival of new child, going through a divorce of parents. The developmental phase can have children are under the age of 4 or when there is significant age difference between them can exacerbate sibling rivalry. So age gap should be uh, more. The more the age gap, the more the development of rivalry is there. Feeling of jealousy, for example, desire of individuality, insufficient conflict resolution skills, and impaired family dynamics may also contribute to siblings rivalry. Parental action that may intensify the rivalry includes frequently commend one child while disparaging another, encouraging competition between children, designate specific roles within the family. For example, Julia excels in math while Benjamin is a creative one. Show a marked preference for one child's need and interest over the others. Now moving to disorder having onset specific to childhood and adolescence. The elective mutation. This is marked by a selective way of speaking that is influenced by emotions. The child may show their language skill in certain situations but remain silent in others that can be clearly identified. The disorder usually appear in early childhood and affect boys and girls equally. It is linked to significant personality traits such as social anxiety, withdrawal, sensitivity, and resistance. Generally, what happens is the child will talk at home or with close friends but may not speak at school or around unfamiliar people, although other speaking patterns can also happen. So, elective mutism means in a selective situation, the children do not speak at all. Tic disorder. You can recognize by the picture what are the tics. So, tics are involuntary repeated muscle movements that can happen anywhere in the body. There are different types of tic disorder, including motor tics, vocal tics, and Tourette syndrome. Movements of the limbs and other body parts are known as motor tics. These movements are involuntary repeated movements, and the tics can be of vocal type also. For example, the grunting, sniffing, or throat clearing are common vocal tics. The tics can be categorized into motor tics or vocal tics and further classified into simple tics and complex tics. In simple tics, engage only in few muscle groups, example nose, darting the eyes or clearing the throat. In complex tics involve multiple muscle groups, for example, hopping or stepping in a particular manner, making gestures or repeating words or phrases. The other disorders are neuresis, encoprasis, stuttering, and cluttering. Non-organic neuresis. This is the condition marked by the involuntary release of urine occurring during the day and or night that is inappropriate for the person's mental age. It is not caused by the lack of bladder control or due to the neurological issues, seizures, or any other physical abnormalities in the urinary system. This may be present from birth or may be acquired and may develop after a time of acquiring the toilet training. Emotional issues can develop as a result of distress or stigma associated with the condition. This is typically not diagnosed in children younger than 5 years or in those with the mental age below 4 years. So this is diagnosable after the age of 5 years when the bladder control is expected normal. Similarly, encompass repeated act of passing stools, whether voluntary or involuntary, in unsuitable locations within a person's cultural context typically involves feces that are normal or nearly normal in consistency. So there is no signs of gut problem. The situation can indicate in an unusual persistent of typical infantile incontinence or a loss of bowel control after it has been learned. The issue can exist on its own and be associated with broader conditions, particularly emotional disorders. So emotional disorders are common in neurosis and encompass. Stuttering is speech that involves frequent repetition or elongation of sounds, syllables, or words, along with regular hesitations and pauses. So hesitation and pauses are the central theme for this stuttering. In cluttering, what happens is there is no repetition or hesitations, but there are quick, abrupt bursts. So the speech seems to be cluttered. So we have learned about the hyperkinetic disorder, conduct disorder, anxiety and phobic disorder, sibling rivalries, elective mutism, tic disorder, non-organic neurosis, encoprasis, stuttering, and cluttering. So these are the disorders of childhood and adolescence with onset usually appearing in their childhood period and adolescent. Thank you.